Hello, I'm Dr. Sukalyan Purkayastha. I'm a neurointerventionist, and today I'll be talking about the endovascular treatment of stroke and of course the carotid stenosis. Now, we know the stroke is a very important disease, and this is the third most frequent cause of death worldwide and the most frequent cause of disability. So we should know why and how stroke happens, and the incidence is around 150 to 200 cases per 1 lakh population worldwide, so which is a very big number, and the recurrence of stroke rate is around 4 to 14% per year. Now, what is a stroke? All of you know that stroke is a sudden onset neurological deficit. That is, suddenly somebody is not able to speak, not able to use his or her upper limb or lower limb, and we know that the patient has suffered a stroke. So, why the stroke happens? There are many causes for the stroke, but the most important cause is the cholesterol deposition in the carotid artery. What is the carotid artery? The artery which supplies the brain through and passes through the neck from the heart. So, there is a focal cholesterol deposition which narrows the artery, and from that plaque, we call it plaque, and from that plaque there can be small thrombus formation which goes along with the blood flow into the brain arteries, and that's how it forms a stroke in the patients. So this is an example in my slide where you can see that the narrowing in the carotid artery, which is more than 70%, and this is the axial image. You can see the in the cholesterol plaque. And what is the interventional treatment, or how we treat it? Obviously, the patient has to be on cholesterol lowering agent and the blood thinners, which will be prescribed by neurologists. And how we treat the narrowing: if the narrowing is less than 50%, we can still wait and watch on medication, but if the stenosis is more than 50%, we have to open it by putting a stent across the stenosis after balloon angioplasty. So this is an example where you can see that the artery is narrowed. We have passed a wire, then we have passed a stent, and then again opened the stent with a balloon. So this is called carotid angioplasty. So this we can do with the help of a filter, or we call it the filter assisted stenting. Then the filter prevents the formation of stroke during the stenting, and sometimes we do without filter as well, but in many cases we want to use filter while doing stenting. So in this slide, I have already described that the indications of carotid stenting when it should be more than 50%. And here is an example. You can see that the carotid origin of the internal carotid artery, which supplies the brain, is very tightly narrowed. The narrowing is more than 90%. And in the second image, you can see that we have crossed with a wire, and we have passed a filter and then opened it with a stent. This is another example where there is an ulcerated lesion, tight lesion, and this is how a stent look like, as you can see that. And in the next slide, and you can see that the whole artery is open and almost looks like normal, and this is the intracranial circulation. Another example where it is very tight stenosis, irregular stenosis, and ulcerative lesions. Again, we have placed a stent, and you can see that how with stenting the circulation can be restored. This is a very tortuous artery, so we choose the stents depending on the anatomy of the artery. So here we have chosen an open cell stent design which conforms to the bend of the artery, and you can see that pre and post images how the lumen is restored with carotid stenting. So in conclusion, carotid stenting is one of the most elegant way of preventing stroke that arises from the carotid artery stenosis. It is extremely safe in experienced hand. Obviously, the alternative to carotid stenting is carotid endarterectomy, which is a surgical technique and which involves a incision in the neck and cut opening the carotid artery and take the plaque out. And what I feel the more safer alternative is the carotid stent. Like the cardiologist places the stent in the coronary arteries, we place the stent in the carotid artery, and that's how we reduce the further risk of stroke that can arise from these lesions. Thank you.